When I started the program, I was enthusiastic, inspired, and filled with hopes and dreams. However, I had a lot to learn. I experienced tremendous growth and knowledge, particularly in my unique clinical experiences. My first clinical was with the child and adolescent population. I was so nervous, I requested to shadow my preceptor the first week. I had no idea how to complete a quality mental health assessment, or so I thought. My first memorable patient was Jane. She was 14 years old with MDD, exposure to community violence. She'd witnessed her father stabbed and killed by gang members. She'd hid from gunfire and had a history of self-harm and SI. I learned appropriate antidepressants to prescribe to adolescents, how to be a resource not only for the child but also for the mother. I also learned how trauma can severely affect a youth's emotional development. And no matter how hard I try, I can't change a child's home environment, school environment, or socioeconomic status. However, I can be an advocate for them in certain settings and help them become resilient and provide hope. During my second clinical rotation, I was challenged with treating a 5-year-old boy who was struggling with ADHD. It was affecting his behavior at home and at school. His parents, though, were the real challenge. This case focused on providing therapy more for the parents than the child, so he can be in an environment that supported behavior change. We focused on parent behavior therapy and setting limits and expectations. At the end of my year working with this population, I went from not understanding pediatric presentations of mental illness, being confident in assessing and providing psychotherapy. I felt like this is what I was meant to do. Then I started my adult rotation. Well, I was more confident. However, I was also nervous. I was treating HIV/AIDS psychiatry patients. How was I going to do this? But I did it, and I truly enjoyed working with this population. My biggest challenge was providing medication management in such a tiny time frame of 15 minutes, especially with their comorbidities and psychosocial stressors. I learned how to work with the resources I was given. One of my clients was Jerry. He was a 56-year-old HIV-positive male with schizoaffective disorder. He was on multiple medications and failed many antipsychotics. We started him on Clozaril. Jerry challenged me in medication management. He taught me that patient education and understanding will have a significant impact on compliance. He gave me my first experience in recognizing the challenges in treating severe psychosis. The beauty of these clinical experiences is that they all built upon each other. In each one, I found growth and increased confidence in providing quality patient care. I become more confident in assessments, therapy skills, and understanding the challenges of prescribing medications. I try to learn as much as I can every day and continue to challenge myself. All my experiences have taught me that I can't fix anyone, to appreciate interdisciplinary collaboration, and most importantly, that I have to meet the person where they are at in their treatment and move at their pace. At the end of my journey at UIC, I've grown to be a competent provider, someone who values continuing education, an advocate for children and their families, and innovative in changing the current system. In my role as a new PMHNP, I want to bring in a more holistic approach to care, recognizing how physical health, home environment, and school environment can significantly impact mental health.